is telling me we are live. I think we are live. Hey,
Yeah,
Tatiana, welcome to our office hour. How are you doing today?
great to be here. Thank you so much for inviting me. It's a nice sunny day over here in London, so all good.
No, that you're lucky. It's not every day we hear London and sunny and in the same
No,
sentence.
it's
So
been a
for
while.
yeah, for the people who don't know what is this, so we call them office hours. It's like an open window to our daily operations. We wanted to bring people we hang out with, people we meet in different occasions in the ecosystem of innovation, in different lines of investment that we are interested in. One of it is digital health, and one in digital health that is close to my heart because I spent like 15 years in women health is femtech. As an ex-Ferring, ex-Gedon Richter, aficionado, this is something I've worked on a lot. First of all, Tatiana, can you tell us a little bit more about you? So tell us what is
Yeah,
occupying your time.
sure, would love to. So my name is Tatiana. I'm running Femtech Lab Accelerator. In my previous life, I've worked most of my career with tech startups as a product manager, as a commercial manager, helping them go to market and fundraise. And since the last 4 years now, I've been running the accelerator. And the Femtech Lab Accelerator is an innovation platform for early stage companies innovating within women's health. We don't specify a sector, so it's sector agnostics and geography agnostic. So we are a global company or global accelerator. We're accepting startups early stage, kind of pre-seed stage. Requirements is to have an MVP or a proof of concept, but you don't need to have active customers or capital raised. And this is exactly what we help. We help startups go to market. We help them fundraise, deliver a great pitch, and at the end of this, the program is 3 months. And we run it for twice a year, and each cohort concludes with a demo day. And this year, this current cohort, it's already our seventh cohort, so we have over 70 startups in our portfolio. And the current cohort will have their demo day at Decoding the Future of Women conference, which is also organized by us, by Femtech Lab. And just to mention that we are also a startup. We're just a small team of about 5 people. So it's a very busy time at Femtech Lab.
And you're like you were saying, you're based in London, but your reach is actually more than the UK, right?
Global, yeah. So we accept applications from all over the world, and I would say probably 30% are from the US. Probably about 60 are from the UK, and the rest are from Europe. We also have startups from Singapore and Indonesia. And Bali and Australia. So it's a truly global company, a global team of founders.
Yeah, that's good to hear because I believe a lot of those startups who wants to reach you wants to go multi-market. They don't want to just be niched in one
Yeah.
market. And also just to give a definition, you were saying about women health, femtech, and obviously there is a lot of conversation in here, right, around the need to focus on and unmet need, not enough funding is going there, and there was a lot, I think, for a couple of years in the last
Yeah.
two, post-COVID at least, a lot of people jumped into the femtech wagon. This is what we saw, and then we saw in digital health specifically like a slowdown. Now, in terms of what you see from a definition perspective, can you tell us more what you will categorize as femtech? Can you maybe tell us like a broad definition? Is it from reproductive age to postmenopause? Is it including much more woman entrepreneurship driven type of businesses, more social mental health? Because you see, so depending on how you look at it, it
Yeah,
could be much broader than biological,
exactly.
concerns, right?
Yeah. Yeah, that's a very good question. And we at Femtech Lab, I've seen so many different uh, definitions, and even like questioning the term femtech. We can go into that whether it's the right term to describe this category. But for us at Femtech Lab, we look at femtech as any tech solution that improves health and well-being of women, and that can be, it can be even a financial solution. Need to mention that it doesn't need it's not specifically for female founders. So we have some of our companies solo male founders. We help them with, we still need some female perspective, so we help them with getting either a co-founder or into their top management team a female. But we have companies solely founded by men, and I think it's important to mention that without male support, none of this will be possible. So we do need, and I'm excited when I have male founders coming to us with solutions for women. So we have specifically in Femtech Lab, we have companies, of course, looking at menstruation and contraception to fertility and menopause, but also, for example, parents tech or kids tech, anything. Or we also have a company, Jack Fertility, that looks at sperm, and we look at it as anything that can kind of elevate the pressure on women when it comes to having babies, also as supporting women's lives. So at home sperm testing is also part of our cohort.
So it's much broader. So I think it's interesting for people who hear a lot about femtech or reports or, in names, that it is not just a biological concern where technology is going to serve a patient adherence type of issue or, pre-diagnosis. It's much broader. It could be much broader, right? So,
It could be, yeah. But I think historically, that's where, from investment point of view, I think that's where the largest portion of investment maybe went initially. Because for investors, when it comes to fertility, IVF, it's something easier to understand maybe, or that concerns like both genders. But
yes.
absolutely, yeah.
So a question regarding now, we discussed a bit about the slowdown in digital health. Like from last year, we started to see not less appetite, but much more precaution in Europe in when it comes to funding. Do you see that as well in terms of the startup you see entering? Are they struggling to get funding? Are they looking for grants in the EU or within the UK? Do you see a shift in dynamics when it comes to the growth of the startups or their journey toward their growth?
100%. I think this is really interesting in terms of a sector growth and funding growth. I think as a sector, digital health is still seeing a lot of growth, maybe not even most growth, but a lot of growth in femtech. That's globally. Maybe in Europe it's a bit different, but I think it's care delivery and digital health in femtech sector that's grown a lot. But from investors' perspective, definitely, because we see a lot of saturation, a lot of solutions that are kind of repeating themselves or building on what's already available. And from, again, I can speak from what I see. We receive probably just under 400 applications I go through every year, and for each cohort, and I see a lot of similar solutions, um, a lot of community-based solutions, and I think investors are kind of looking at the market is being saturated, so they're looking for other verticals.
I can tell you from a pure due diligence or pure investment perspective. Right now, we see a divide. Clearly, one that is connecting also with what we discussed preparing this call just in the lobby. We have clearly a more scientific play, more R&D play, more long term, where the play where to win will be the clinical evidence generation,
Yeah.
showcasing scientific progress in terms of
Mhm.
demonstrating or supporting existing studies or supporting new endpoints in future studies. So
Yeah.
obviously here you'll have grants, universities, public funding that is interested to push the bar, and some startups are kind of patient facing. right, or consumer facing, that they can do that mass collection of data. Second, I think is more of a, uh, I will call it marketing play, but it's not nice to call it like this. It's more like you said, this kind of Instagram-ish play that we are going to bring more services, more added value in the daily life. It's not necessarily something that is going to be pure scientific generation
Yeah.
of evidence, but it's going to be like bringing, I remember when we were working on this, like bringing a mental health coach. Like mental health coaching is having a tremendous impact on, for example, the recovery after a failed
Yeah.
cycle, and
Yeah.
a failed IVF cycle, just to be precise.
Yeah.
And this is the type of services. So it's a service. It can be marketed. It can be reimbursed. It can be collecting data, and it's the most prominent aspect of that service is to change a behavior, to bring
Yeah.
someone, to keep someone in track. So I see really two divides: something that is more expensive to invest in, but has a better business case in terms of the scientific share of voice that you can have. And those companies are often also attracting classical biotech VCs who want to diversify to digital health. And the one that are more, I would call it Instagramish, which is not a good name, but
Yeah.
something that is more consumer-ish,
Yeah.
right? Something that is more consumer, more community based, more lifestyle based, which is still important in my view. These
Yeah.
are basically also consuming much more funding when it comes to growth in terms of, social media marketing, PR, Google AdWords, and we know that when you raise a ticket post seed, one third of your money is going to be sucked in by those platforms, and that's
Mhm.
when you have the choice as an investor: do I go basically investing in the science,
Yeah.
even if this is long term and more risky in a way, but at least I invested in a data scientific team, or
Yeah.
do I try to get 5 million users in a PSP, in a patient support program, that is still
Yeah.
important, but to take it to 5 million people, I need to basically pump the machine, right? I think there is those two duality. I don't know if you agree, but I can sense that two duality even within healthcare companies like pharmaceutical companies. I can sense a
Yeah.
divide.
100%. And I'm super interested, Haida, from your perspective as an investor, um, like what's your criteria, and maybe what would be your advice to our founders? What are the criteria that you, first of all, would you look if we take early stage startup like pre-seed, seed stage, what is the criteria that you look at, and what kind of KPIs
Mhm.
you would look at, and what would be your advice for the founder to focus on?
So, so when we started this back in the day, when we were trying to find our tethers, and we were saying, where do we have a purpose? Where people will actually miss us if we
Yeah.
didn't exist, right? And we identified that the European market has something very specific, is that this is an engineering ground. People love to build product. They don't like to sell it. They like to build it. So we said, already we have a first kind of issue, is that we have a lot of those. Sorry, I have some noise around me. Let me just make sure that
Busy office building products.
yeah, yeah, yeah. It's just so just let me just tell them to just you know
Be quiet.
Oscar. Okay, that's okay. It should be fine. So basically, yes. So the cost of building something for 1, 2, 3 years, and you have not even taken a percentage of your roadmap into the hand of a user,
Yeah.
and you have not identified a business model out of that, it's quite concerning, for me.
Mm.
So this is what we wanted to tackle, to bring that kind of business acumen from the US, which is much more saying, yeah, we have great ideas, but let's start small and let's
Yeah.
scale. That is the first basically criteria. Can we attract someone's votes? Can someone vote for that idea, like a letter of intent? Like, we need to identify companies that at least have something. Could be just a promise, it could be a product, it could be anything that is converting someone, like real LOI, not just a paper. Like someone who says, if this product existed, I would put down my money into it, right?
Mhm.
So that is the first one. The second one, I think, is is someone who understands the business model and understanding the cost of not growing more. So I like this vision to say, I understand my market. I understand if I had 2.5 million right now, I could actually run that traction. And the confidence of a founding team that can say that means that they
Mhm.
identify the business model, they know their customer, they know they can deliver, and they just need the fire to take it, right?
Yeah.
But that is a very, maybe in the UK you don't but you're quite aligned with the kind of, US way of running, some businesses. But if I look at Switzerland, where I'm based, we like the engineering thing, right? Like
Excellent.
we like to engineer, over engineer things,
Yeah.
which is good. So
Yeah.
that will be my two answers. There is something that is specific to digital health. We invest also in fintech. I'm actually sitting today in one of the. It's the first time I actually sit in the office of this new fintech company we just brought to Geneva. And in fintech, there is a different aspect than in healthcare. In healthcare, you have to be holistic to
Yeah.
really showcase value. So the problem of this US way of running a business to say, let's start small and scale, at some point you need to solve the clinical practice, the patient, the payers, you need to solve the industry, and you need to be like an octopus very
Yeah.
quickly. And
That's
I
a very
think
good
that is a paradox that on one hand we force companies to have a very quick scalable business model. So we love that from
point.
a financial perspective, but the
Mm.
industry specific of healthcare requires you to be that octopus, which is taking a lot of energy and money, which is counterintuitive. So I think the companies that I see that have managed to do that well in the last 5, 10 years are companies that knew exactly that domino effect, what to tackle step after step to become that
Yeah.
octopus, and they
Yeah.
used part of their roadmap to kind of elevate themselves to build
Yeah.
that ecosystem. So that's
Yeah.
kind of is what I would say on my end. Yeah.
I think this is super. I love that insight. And it's almost like we need a different venture or investment model for digital health or health tech startups. Um, and you can't measure them by the same metrics or by the same ruler that you would fintech. And especially for women's health, I think it's even tougher in many, because you then have to convince so many other stakeholders. Um, that's fascinating.
And I can tell you one thing that if I compare it with, I use this example all the time with fintech, but it is something that is also counterintuitive because there is no therapeutic area structural body. Like there is no one saying we need a market leader in, like I was using in our Dixie example before, like in fertility. I need a market leader in sperm scanning, like a sperm testing,
Mhm.
and and that sperm testing company needs to have that protocol to be able to transport that data to another set of companies that are going to do pre-diagnostic. And because
Yes.
there is no body structuring that conversation,
Yeah.
there is no Thermo Fisher saying, "Oh, here's the API to transport data from our machine to this machine," right?
Yeah.
So it would be easier to basically glue yourself to Thermo Fisher machines or Edward Life Science, Beckman Coulter or whatever, and basically to create an ecosystem out of it.
Mm.
And what I liked in the fintech industry is that you have Visa, Mastercard, American Express that created like
Yeah.
clear stratifications. They say, "Oh, you want to be an acquisition partner? Here are the criteria." And of course,
Yeah.
the regulator is saying, "Yeah, of course, like we mimic exactly what Visa and Mastercard has pushed in their compliance system." And suddenly you have new fintech players because they position themselves at doing one thing, but because they are part of an ecosystem, immediately they connect to
Yeah.
the octopus. And I feel the problem from an ecosystem perspective in maybe women health, but it's broader because a startup starts and the startup doesn't know what is the other branch of the octopus. Basically, they start redoing another roadmap, and we
Yeah.
lose funding and energy. So
Yeah. Yeah.
that kind of is, you see, the reading of the market for me, is complicated and wrong.
Yeah.
And my philosophical answer to that is either the pharma industry or the medical industry can take the leadership role because they know a lot about scientific molecules and that kind of thing. So I take the example of Novo Nordisk, right? If Novo Nordisk decide to basically now spread their diabetes, wisdom and say
Yeah.
from now on, because we are so savvy about diabetes and this is what we are going to structure. So any startup will be able to hook themselves to that ecosystem reading, but they
Yeah.
don't. For some reason, it's like these are just too complex.
It's too.
That is where in women health, I will say you have all those we were talking about them, Organon, Merck, Bayer, Ferring, those companies, Guido Richter, those companies. If every one of them is basically starting to be on the same page, saying, yeah, we need to have electronic health record to be structured that way for that particular disease, at least we start having a pressure point on governments and payers and regulators and insurances. And it's not the case. It's a mushroom of the spaghetti of things. And if you are a startup, you are tempted to fix it all yourself. And this is where, from an investment perspective, we say, oh gosh, just do this one little thing in your corner. And
Yeah.
unfortunately, because of this, to finish my point, because of that unstructured ecosystem, it's an M&A play. It's almost a private equity play. Right now, I see digital health companies starting in Europe. They are over-engineered, undervalued, and they are looking for either emerging market like India, China, if they want to
Yeah.
play the emerging markets, or they go to the US, which is a more reimbursing market. Some of them stay in Germany for Germany reimbursement, that kind of thing, because they're medical device, so class 2B, whatever. But
Yeah.
usually they want to accelerate to bigger market to get a better valuation, which means the US is clearly near
Yeah.
the horizon for them. And then basically they expect that a bigger fish will eat them, right? In
Yeah.
terms of acquisition. So why I'm saying that to you is how much of your portfolio company will actually become IPO? Not a lot, right?
No.
They will
No.
not reach IPO status because of that, you know,
Yeah. IPO, yeah,
situation.
it's a very long shout. M&A is still very a very rare exit. But I think just on your earlier point, I have two comments. First is we see investors, and exactly to what you were saying, we see investors. Or I was just speaking to a early stage fund in the UK yesterday, and they said that they no longer invest in point solution like digital health, medtech, whatever, and they're looking for, they're specifically interested in companies building that infrastructure layer. So software businesses building interoperability layers for to kind of help. So without looking into those larger corporates to come up with a solution, to start, and like I said, founders are trying to solve these problems themselves. So we've seen I completely forgot the name of the company, but they just raised a quite a lot, I think about 20 million round for interoperability layer for IVF clinics to be able to exchange data. And so I think that's kind of one extra now area of interest for investors. But on the other point, if we look specifically at women's health, I think there are still so many white spaces. There are still so many unaddressed problems in women's health, even on a small scale, that there is a lot of potential for new companies coming in and raising money, whether it's digital health or medtech or biotech is slightly harder, but still, I think there is so much data required, innovation required. AI is helping us with that a lot, but yeah, I think the outlook for myself at least is quite positive in that
But,
sense.
so I have a question for you. Do you have have you seen this AI fever coming to your startup in the last 2 years, right? Because we
Yeah,
keep seeing so much
yeah,
discussion about it, and honestly, to be honest, like right now, it's so much, maybe even too much, to be honest. Like it's like we don't
yeah,
even know what is the problem we were trying to solve in the first place. I just received slides with we are
yeah,
AI driven, and that
yeah.
people are happy, right? So can you talk to us about how do you help those companies who get tempted
Yeah.
to do this AI washing, and because
Yeah.
it's quite dangerous at the end of the day, because they disrupt their roadmap, they kind of also pivot. A lot of them are trying to find
Yeah.
a new mission that is AI driven, but we all know it's a data play, right? If you don't have the data, there is no point. So
Exactly. Yeah, you pretty much answered my the question, because we have a few, most of our startups now want to have a AI element, and in order to for it to make sense, you need to have data. And as we know, in women's health, data is one of the biggest challenges. We just don't have enough data. But there's a case definitely, but building AI for the for the sake of AI, of course, is just it's becoming almost like a red flag. But what we try to suggest is try start manual. So buildings, you can really utilize initially Excel spreadsheets, and this is what one of our great startups, one of the first startups in the first cohort, they're now raising Series A, locked up. It's a
okay,
now AI enhanced breast uh, support for breastfeeding for mothers. And they're based in Spain, but they are operating globally. And ChatGPT and AI really allowed them to scale. But initially, when we were talking to the founder, for the first 3 years, they were just adding data manually into the spreadsheets and just building those logic around the chats. So I think, yeah. What have you seen? I'd
I
love
mean,
to hear
uh,
your opinion.
so for me, indeed, so for me, I see companies that are a little bit concerned about missing the train, right? So it's kind of
Yeah,
I need to be as good as, otherwise I'm feeling behind,
yeah,
and investor will want to feel jumping on the right train. So I think this is where I believe if we start designing companies for not the purpose that is to help patient in the clinical practice, but basically to get an investor ticket, I think this is where it starts to be the wrong
yeah,
play. So I think this comes from a temptation to look good, and also I say to, and I have nothing against Microsoft, Amazon, Google, who give credits, to startups, to even give them hand
yeah.
to build an AI driven service and whatever. This is all
Mhm.
good, right? If you are in an R&D mindset, like you say, hey guys, we are testing new stuff in our roadmap. Of course, we have some lab tests, right? But
Yeah.
right now, those lab guinea pig tests, whatever, are getting into production, and they're
Mhm.
into the main slide. And I'm thinking, are you then a company that has been like doing data scientists and ML ops for 7, 10 years, or are you just basically like, putting this sugar on the cake, just to look good? I would say this is very visible, at least for us, me and Lorenzo and the team. I mean,
Yeah.
we can spot that very easily. There are some aspects where indeed it's like critical to manipulate a lot of data when you have tons of electronic health record, ton of data, and you need to start basically creating models to go quicker. I would
Yeah.
say most of the models I've seen in digital health right now are designed to get faster, not smarter, if that makes sense. It
Yeah.
feels smart because it's super quick, but it
Yeah.
is AI used to be smarter, faster,
Yeah.
and it means that right now, this is not AI designed to take a better decision than a human. It is an AI that is assisting a human to do his task normally faster. So I don't know if
Hmm.
that makes sense. So the
Yeah.
good
Yeah.
example is I have a skin radiography or whatever picture, imagery, and I need to basically compare them. I need to triage them, and I need to help someone who is going to do some data annotation and tag them. And I'm going to pre-assist. I'm saying, I believe this picture is this. I believe this picture is that, and that is basically just putting the potential doctor revising this in a position of, yes, that's actually correct. That's not correct. Like the captcha thing,
Yeah. Yeah.
if,
Yeah.
like you need to select the buses and so on. So
Yeah,
I would say
crosswalks.
yeah, I would say when AI is basically an assistant helping you doing the job better, I think this is good. I think this is
Yeah,
actually smart, because it helps you get faster. Who doesn't want it? I think this is we're all willing right now to expect some magic pill, like I use the Tesla driving in the street alone, like oh
mm,
gosh, like we are now in a new area because we drive car, we don't even drive car anymore, right? And that is, I think, where people are expecting the same level of craziness in healthcare. So what would be the equivalent of seeing a car driving itself, but in the healthcare space? Could be that suddenly you get a bunch of data points, and your app or whatever is giving you some chances of pregnancy, chances of or risk of being sick, but with an accurate level. Like if you basically
yeah,
say, oh, if I have not used this, I would have continued to have this bad behavior toward my health, and I
yeah,
would not have changed. And I think we're all waiting for that kind of magic pill
yeah.
that is going to tell us, oh, this is sure. If you continue to eat that, you're going to have a serious issue, right?
I
And
think
that
this is
kind
this.
of is what I expect. Yeah.
Yeah, I think I totally agree. I think this is where we are. If we talk about trends in health tech and femtech, personalized AI enabled and machine learning enabled personalized solutions are 100% the future. I'm expecting to see a lot more companies coming up with that kind of personalized nutritional plans, personalized fertility selection solutions for your specific like hormonal disbalance, for example. So I think in that sense, that's fascinating. Yeah,
Yeah.
of
So
Zoe.
correct. So this is typically um, this is typically where, oh, I would say the real, it goes fast. The real game changer will come in the next couple of years. I would say we will start to see companies who are very mature. They have the data. They have millions of users, and they have points. And we are going to see some therapeutic area, big changes, right? When it comes to getting diagnosed faster, getting better treatment adherence, that kind of thing. I think
Mm,
also, the whole concept of healthcare is going to be challenged when it comes to femtech and women health. I would say we are not going to see a women health around women just from reproductive age to postmenopause. It's going to be much broader. It's going to be mixing it with wellness, well-being, sports, nutrition, and it's going to
yeah,
be a much more holistic approach to it
yeah,
than just trying to fix your healthcare issue, if that makes sense. It's going to be like delaying obsolescence. Like we are going to push bad things away as much and as fast as possible. And if technology can help you disrupt your behavior, then so be it. And I think this is what is going to attract much more funding in the future. You will have still, I will say it as layers. You will still have the classical near to the clinical practice layers, like the hardcore
yeah,
stuff, when it comes to biometric data, taking blood samples and that kind of things. But I would say where it is harder to do is changing your behavior. It's a kind of in your mind type of thing.
yeah,
And the scalability is,
yeah,
it's much harder to scale people going to a lab and take blood samples. It's much uh, easier in a way to scale people reading and like enrolling a program of a wellness program and understanding that they need to change their behavior to continue being in good health, right? I would say
yeah,
that is going to be the gold rush in digital health, especially in women health, because even governments will have, fertility is going to be one of the big issues, and there will be a lot of government fighting to have more than 2 kids per woman
yeah.
in the next few years. So it's going to be a huge push from government. Yeah, I don't
Yeah,
know what
no,
you
I
think, but yeah,
I couldn't say it better myself either. I agree. Yeah, I think fertility will definitely continue to attract funding and innovation. But I think that um, behavior changes is an interesting one, and it's almost like creating your digital twin, I think is also what we'll start seeing,
Hmm.
almost like predictive analysis of your behavior, taking data from all different aspects of your life, and different devices, different GP records, whatever, and predicting possible what can happen to you health wise, and changing your behavior. Yeah, I think this is interesting. We're seeing a
And I
lot
think
of
and I think the level of also of right now the level of disruption, is to be much frequent. But when I say disruption, is like the number of people who will start something. Like we see a new flux of strapped IDs because it's much easier to build something, right, with a low code, no code era. Right
yeah,
now, it's you don't need really to have a lot of people, right, to launch
yeah,
a product, launching an
yeah,
idea. I think that is also it's a good thing for most people because they can test an idea pretty quickly. It's also a not so good thing because then, from a pure technology perspective, we say to people at some point we invest in the team as well. Having
yeah,
and having nothing against agencies and helping out and so on, but we say to people, be careful of building, you know, companies with empty assets. Like even if the IP is
Mhm.
signed with a contract and so on, you still don't own, the team. So what happens if you don't have developers, right? If you so that is also a risk. Is while those technologies are going to help get much more people innovating in the space, it's also coming at a much more influx of not so bankable companies, if that makes sense.
Yeah,
A lot of good
yeah,
ideas on paper, but the filter is like you will have a lot more difficulties to find the hidden gem that can be a human organization that can. And a lot of people will hate me for that because they will think, no, we don't need a human organization to
yeah,
actually scale. But potentially tomorrow you can have like a customer center in 50 languages with just Gen AI, right? So people are going to
yeah,
tell me, yeah, no, this world has changed, and I still believe that while there will be new form of progress, right? At the end of the day, it's still people who are going to design,
yeah.
solutions that are going to be new business models that are going to. The art of taking decision is still
Mm,
not disrupted, right? So this is what is tackled. Taking a good decision, whether you are a doctor, whether you're an investor, whether you are a CEO of a funding startup, that is not getting replaced, right? And that
mm,
is where I would say you can get insights from a lot of data. But I would say this is where a doctor will still have that kind of feel that override a decision. And maybe this is not for a bad reason, that they can in hospital they will be potentially say, yeah, I know the right thing is to just follow the process. So, but
yeah,
potentially in that case, I will override because I believe it's the right thing to do. So I just believe that there is still a creativity from a perspective has still like some beauty into it. So I'm not reluctant to change. Actually, I like it, and I'm investing in it. So believe me, but
yeah,
I'm also trying to create a model where we are not just bodies walking on the streets having no
yeah.
purpose, and everything is assisting us. You see what I mean? So that vision of the world is not pleasing me. I'd like to be still on the creative seat, if that makes sense.
And it's super important, I think, to keep that decision making, like the end decision should be with the human, because it's super easy to give in into the pre-designed process. This is, but I
Yeah.
love what you said about beware of building a company with no assets. It's going to be my Haida quote. I
Yeah.
really like it. I think it's super. It's really great for kind of quickly checking your product market fit, just to test ideas at first. But then you do need a proper team and IP to own within your company. This is great.
Yeah.
Great quote. I love that.
No, no, you're welcome. I mean, for me, it's. I mean, we see a lot of different things, and we try to understand what is the pattern, even for ourselves, right? We want to become a data-driven machine. We say, okay, what is
Yeah.
happening where something works? What is the magic of a company that can go from nothing to
Yeah.
something, and it's just having is it luck? And I'm not sure. I think it's not it's not necessarily just luck. There is a science to it. There is like the way those C-level people in those startups have been able to create a network. They've been seeing opportunity where others didn't. They've been
Yeah.
taking like a risk where others didn't. That is for sure.
Yeah.
Their resistance to the stress, their resistance that at the moment where everything was going to die, they were still standing on their legs and being, I would say, leadership and entrepreneurship are two great muscle when they are combined in one person, right? And if
Yeah.
you don't, then it's okay. It's not, and I think I've seen better teams that one was a leader, like really breaking the walls, building the bridge, and one was an entrepreneur, like really crafting something out of nothing, like literally creating a product out of thin air, right? And saying, I see, I see what we could sell. I see how we can turn things around. So,
Yeah.
I believe that that part, that combo of different people joining forces together, that unique mix, it's that perseverance, like this, like the fact that you continue pushing where no one sees the light. I think that is what makes great startup going forward, and that is what I would say reassure investors that something is going to come up. They will not back down. And the other piece is like sometimes, yes, indeed, time is of the essence. I see some startup who started at the right time, they had the right signal, they started the proper way, they took the market by storm, and they took a position of too big to fail. And I always remember one of my former bosses in like 15, 20 years ago. He said there is one rule on the internet: you start first and you accelerate and don't look back, and then you're going to be uncatchable. And that
Yeah.
is, I think, some tech startup understand, and they basically just accelerate. They just like the Facebook at in 2004, right? Just taking
Yeah.
the market by storm to have as many users as possible, to be too big to slow down. Yeah, I would say
Yeah.
so. That is some digital health startup. If I look at Medable, decentralized clinical trials, I would say that lady who created Medable has literally understood that once she owns a sizable piece of the market, obviously, if you want to do decentralized clinical trials and have the faster time to market, you cannot not think of her, right? So she's going to be in the conversation. And I think this is where, by therapeutic area, some of the startup needs to balance the need of the science to have good data, good science, but also the critical size on the market. Yeah,
Backed data, critical size, and assets, team IP. I like that. We have a recipe for a successful stuff for a unicorn.
for sure. So yeah, so that's pretty much what I wanted to talk to you about today. So anything else that you will see? We didn't discuss about, in the world of accelerator. We always say, 3 months, 6 months. We touch upon that, like is it 3 months, 6 months, 9 months? What good timing is enough for a company to take value out of an accelerator? What
Yeah.
would be for you the real added value if someone was hesitating to think, should I sign up? Should I actually spend some time? Obviously, you
Yeah.
see, so there is a limit. You cannot be just running your time in accelerator. So what would be the the recommendation here from your side?
That's a great question, and I think it's it depends on the stage of the business, but so why would a founder consider going to an accelerator? The idea is that so for us it's 3 months. I think 3 months is kind of ideal time, because 6 months or 9 months maybe for a venture studio, but for an accelerator, that can be a bit too long, because what you really need is you need network, you need connections, and you need to funding. right? So those are the three main things that Accelerator can help with. And that's why you have, like Femtech Lab, you have specific sector-focused accelerators. Femtech companies can go to other YC and Techstars and be super successful. But I think it's good to consider your sector-specific accelerator, because you can get injected into the right network very quickly. And this is what we do. We build our network, partnerships, collaborations. So we look at potential go-to-market partners, be it retailers, Boots, Tesco's, Superdrug. We partner with Holland and Barrett. So anything that, and especially, and also pharma. So companies come into our accelerator that get those connections, which would take them longer in the real life. They initially, like they get into the room with these people. So that's, I think, super valuable. And my main job is to make sure that the valuation for the companies before the accelerator and after accelerator has grown in those 3 months, quicker than it would have grown without. And you've mentioned how, like, when you assess founders, you look at their network, or how ability and skill to build network quickly. And I think this is the main value of accelerators. If they can put you in the room with the right person who can sign that letter of intent, that can be your potential exit partner or go-to-market partner, that can put you in the room with investors and help you fundraise, that's the biggest value.
I see. No, that's a good point. So for me, I would say indeed. So we use accelerator kind of like a filter on the market to see if
Right.
someone went through one reputable accelerator with decent mentors, people who
Yeah.
got the eye on the. I mean, it can help us get better idea
Yeah.
of the maturity of the project itself, because
Right.
obviously you have also criteria at the end of the day, right? There
It's a
should be
due
the
diligence
metric.
process as well. Yeah, that's
Yeah,
true.
so it's not necessarily financial due diligence, but it's from a market fit, product fit, maturity of the company. It helps us get out of the door. Maybe founders are a little bit too young, right, in terms of
Yeah.
maturity. So on that
Yeah.
end, that is one. And the second, I would say some accelerator that also provide funding, right?
Yeah.
Could also help fine tune their first value proposition. So it's also going to help get published. I would say 3 months in digital health for me, at least. We can disagree on that. For me, 3 6 months is a little bit too early. Why? Just because if you have to deal with a pharma company, for example, when the corporate
Of course.
weight,
Yeah.
the meetings, the steering committees, and that kind of thing will definitely slow. I mean, in 3 months, it's kind of
It's
impossible to
nothing
do
for
something.
biotech, of course. That's a good point. Yeah.
So yeah. But on that note, I will ask if someone has a question. Feel free to replay this and ask question on the comments section below. So this is something that we can comment on, me and Tatiana,
Yeah.
further along. So that's not a problem. On this, do you have any note on when is the next cohort if people wants to apply? Maybe if you can tell us.
We are currently will be opening applications in May to sign up for the next cohort, but we're still deciding on the dates. But I would urge everybody to check out Decoding the Future of Women conference, where this current cohort will have demo day, or just in general, if you're keen to learn about innovation in women's health, this is the place. 11th, 10th, and 11th of June. Um,
Perfect. So if you're around, right, in London, and you're like asking, yourself, are you the right fit for tech and women health and technology in general? I think Tatiana, you could be the right door to ask that question too. And
thank
on that note, I would say we can wrap up. Please follow up Tatiana and her team on what they do on the Femtech Lab. I think you're doing some good stuff there, so it's interesting to follow you there. And on that note, see you on the next episode, folks. So feel free to ask questions and join us for further conversation with people in our network. Thank you.
Thanks, Haida. It was a pleasure.
Thank you.